Let me tell you about a woman named Adama. She lived in a small village, hundreds of miles from the nearest city. Her story isn't about war or famine, the things you usually see on the news. It's about something much quieter, but just as deadly. Adama was pregnant with her third child and she was so excited. Her whole village was excited. A new life is always a reason to celebrate. But when it was time for the baby to come, something went wrong. The village elder, a woman who had delivered hundreds of babies, looked at Adama with worried eyes and said the baby was stuck. It was a problem a simple surgery could fix. A C-section, a procedure that happens thousands of times a day in other parts of the world. The problem was, the nearest hospital with a surgeon was a 2-day journey away. Her family pooled all their money, hired a motorcycle taxi for the first leg of the journey and prayed. They carried her over dirt roads through the sweltering heat, hoping against hope they would make it in time. This wasn't a journey for a new job or a better life. It was a race against death. They finally got her onto a crowded bus, the air thick with diesel and desperation. The bus rumbled on, a slow-moving vessel of hope. Tragically, Adama and her baby didn't make it. They died on that bus, just a few hours from the hospital. Her story is not an isolated incident. It's a story that repeats itself thousands of times a day across the continent. So why did Adama die? The simple answer, there was no surgeon. But the real problem is much bigger. A giant tangled knot. First, the doctors. In many African countries, one surgeon for every 250,000 people. By contrast, one surgeon for every 2,000 people in the US or Europe. It's not a gap, it's a canyon. But even if you have a surgeon, where do they work? You can't do surgery in a parking lot. Many rural areas only have small clinics, not equipped for surgery. They might not have reliable electricity. The lights could go out mid-operation. They might not have running water, crucial to prevent infections. Then comes the hardware. Surgery needs more than a steady hand, a whole orchestra of equipment, anesthesia machines, sterilizers, monitors, sutures. In many hospitals, this equipment is old, broken, or missing. Surgeons using a bicycle headlamp because the overhead light is broken. Finally, supplies, anesthesia drugs, pain medication, antibiotics, blood for transfusions. The supply chain can be a nightmare. Trucks break down, roads wash out, paperwork stalls. A patient survives surgery, then dies a week later from a simple infection for lack of antibiotics. A cruel, heartbreaking irony, death by 1,000 logistical failures. This is the reality of the surgical crisis in Africa. A complex web, every thread stretched to the breaking point. But even in these conditions, heroes emerge every day, fighting to save lives against impossible odds. Let's do a little thought experiment. Imagine you're at home, cooking dinner, and you accidentally slice your hand open. It's a deep cut. You need stitches, maybe even surgery to repair a tendon. If you live in London, Tokyo, or Toronto, you wrap your hand in a towel. You or a friend drives you to the nearest emergency room. You'll probably wait for a few hours, complain about the hospital food, but with almost 100% certainty, a trained professional will see you. They fix your hand, your life isn't in danger. Your biggest worry is missing your favorite TV show. Now let's rewind. Same accident, same deep cut. But this time, you live in a rural village in Malawi or Chad. What happens now? First, the nearest clinic is a 6-hour walk away. There's no ambulance. You wrap your hand in a piece of cloth. You start walking. Blood is dripping down your arm. When you get to the clinic, the nurse says, "This is bad. We don't have a surgeon here." The nearest hospital with a surgeon is another day's journey away, and you have to find money for bus fare. So you begin another desperate journey. Your hand throbs. The risk of infection grows with every hour. By the time you reach the hospital, you might have lost so much blood, or the infection might be so bad that you lose your hand, or worse. This is what I mean by the surgical lottery. The outcome depends on your geographic coordinates. In one place, it's a minor inconvenience. In another, it's life-altering. In another, it's life-ending. We've built a world where access to health and life is determined by the luck of the draw at birth. That's fundamentally, unequivocally wrong. It's a lottery that nobody should be forced to play. Now, after all that, you might be thinking this is a hopeless situation. But that's not true. The story isn't over. A new chapter is being written as we speak. Over the past 10 to 20 years, something has started to shift. People realize you can't build a healthy society without surgeons. You can give people all the vaccines and pills in the world, but it won't fix a broken leg or deliver a baby that's stuck. The global health community is waking up. Surgery is essential healthcare. One big change is training. For years, the model was fly in foreign surgeons on short missions. They'd operate, then leave. It helped, but it wasn't sustainable. Like giving a village a fish instead of teaching them to fish. Now the focus is training local doctors to become surgeons, training local nurses, and training technicians to support them. Organizations are partnering with African universities to build surgical residency programs. Young, talented African doctors don't have to leave the continent for training. We're seeing new, innovative healthcare models. Instead of building massive hospitals everywhere, people are getting creative. Mobile surgical units, operating rooms on wheels, travel from village to village, and finally, global support. International organizations, governments, and private individuals are stepping up. This isn't old-fashioned charity, it's partnership. Working alongside African doctors, health ministries, and communities to build resilient systems from the inside out. There's a long way to go, but momentum is building. The tide is slowly but surely beginning to turn. That should give us a profound sense of hope. When you think of a hero, you might picture someone in a cape, flying through the sky, but I want you to picture someone else. Picture Dr. Agnes, a surgeon in rural Uganda. She is one of only a handful of surgeons in a region of over 2 million people. Her day starts before the sun comes up and ends long after it is set. She performs C-sections, she removes burst appendixes, she sets broken bones, she treats burn victims, she works with old equipment and a constant shortage of supplies. She faces blackouts, water shortages, and the endless crushing weight of knowing she can't save everyone. But every single day, she shows up. She fights for every life. She is a hero. These local healthcare workers are the true protagonists of this story. I heard a story about a nurse anesthetist named Joseph in Sierra Leone. The hospital's only anesthesia machine had been broken for months. So Joseph, using his knowledge of mechanics and medicine, pieced together a working machine from spare parts. It wasn't pretty, but it worked. It allowed surgeries to continue. It saved lives. This isn't something you learn in medical school. This is ingenuity born from desperation. And it's not just the doctors and nurses. It's the community health workers, the volunteers who travel on foot from village to village. They are the eyes and ears of the health system. They teach families about hygiene, identify high-risk pregnancies, and spot surgical problems. They are the ones who convince families that the long journey to the hospital is worth it. They build trust. They are the connective tissue that holds the entire system together, often for little or no pay. These are the people who are changing the narrative. They are the heart and soul of this movement. No hero, no matter how dedicated, can win this fight alone. That's where partnership comes in. This isn't about one group saving another. It's about collaboration. Different people bringing their unique strengths to tackle a problem too big for any one group. It's kind of like assembling the Avengers, but for global health. You need the brains, the muscle, the funding, and the local expertise. One powerful example is organizations like Mercy Ships. They have giant hospital ships, literally floating hospitals. These ships are staffed by volunteer doctors, nurses, and engineers from all over the world. They dock for months and provide thousands of free surgeries. They fix cleft lips, remove tumors, and straighten children's legs. But they don't just operate and leave. A crucial part of their mission is training. Then you have groups like Partners in Health, who have a philosophy they call accompaniment. It means they go to a place and they stay. They don't just swoop in for a short-term project. They become part of the community. They work with local ministries to build hospitals, train staff, and strengthen the entire public health system from the ground up. They understand that you can't just focus on one disease. You have to treat the whole system. And it's not just big international NGOs. It's universities partnering with African medical schools. It's tech companies helping develop mobile health apps for remote areas. It's Rotary clubs buying ambulances. It's individuals donating time, money, or expertise. Every little piece matters. It's a global movement gaining strength every day. It's a recognition that the health of a child in a village in Liberia is connected to the health of our global community. It's the world showing up, not as saviors, but as partners, to say, we are in this with you. Let me tell you another story, but this one has a different ending. It's the story of a young boy named Samuel from Rwanda. Samuel was born with a hole in his heart. It's a condition that, in a wealthy country, would be detected and corrected in infancy. But for Samuel, it meant a childhood of sitting on the sidelines. He would watch his friends run, play soccer, his own heart beating a weak, frantic rhythm. He couldn't run. He could barely walk to school without getting out of breath. His parents took him to local healers. They prayed, but his condition only worsened. His dream was simple: to kick a soccer ball with his friends. One day, a team of community health workers, trained by a partner organization, came to Samuel's village. They were screening children for heart conditions. They listened to Samuel's chest and immediately knew something was wrong. They arranged for him to travel to Kigali, to a hospital with a new cardiac unit. A unit built in partnership with international doctors and donors. For the first time, Samuel's parents had a real diagnosis, and more importantly, they had hope. A team of Rwandan surgeons working alongside visiting specialists told them they could fix their son's heart. The surgery was complex, but it was a success. For the first time in his life, Samuel's heart beat with a strong, steady rhythm. The recovery was tough, but every day he got a little stronger. A few months later, I saw a picture of him. He was on a dusty field, kicking a soccer ball. He was running, he was laughing. He wasn't just running on a soccer field. He was running towards a future that had almost been stolen from him. That surgery gave him back his childhood, his dream. Let's talk about something that doesn't always kill you, but can steal your life just the same. Imagine being a young woman, a mother, who after a long and difficult childbirth is left with a devastating injury, an obstetric fistula. It's a hole between the birth canal and the bladder and the rectum. It leaves a woman constantly leaking urine, leaking feces. In an instant, her life is destroyed. Abandoned by her husband, shunned by her village, considered unclean. Now meet Fanta, a woman from Guinea. This was her life for 10 years. For a decade, she hid herself away. Didn't go to the market, didn't visit family, didn't attend weddings or funerals. A ghost in her own community. The smell, the shame, a constant prison. She thought this was her destiny, a punishment from God. She had lost all hope. Then, one day, she heard a radio broadcast, a program about a hospital hundreds of miles away, doctors who could fix her condition. With a tiny spark of hope, Fanta made the long journey. At the hospital, she met other women just like her. For the first time in 10 years, she wasn't alone. Treated with kindness and respect. A skilled surgeon performed the operation, a procedure that took about an hour. After a few weeks of recovery, she was healed. She was dry. For the first time in a decade, she was free. When she returned to her village, she walked with her head held high. She reclaimed her place in her family, in her community. She reclaimed her dignity. She reclaimed her smile. We started with the heartbreaking story of Adama, a story of a system that failed. We end with the hopeful stories of Samuel and Fanta, stories of a system that worked. The road ahead is about creating a world with more Samuels and Fantas and no more Adamas. It's about ensuring that no one dies from a condition that a simple surgery could fix. This is not a matter of charity. It is a matter of justice. Access to safe, affordable surgical care is a fundamental human right. It is as essential as clean water, as vital as education. A country cannot be healthy, it cannot be prosperous, if its people are dying from treatable surgical conditions. The good news is, we know what to do. The path forward is clear. We need to continue investing in training. More surgeons, more anesthetists, more nurses. We need to focus on training local people who will stay and serve their own communities. We need to strengthen health systems, building hospitals, equipping hospitals, so these professionals have a place to do their life-saving work. We need to innovate, using technology and new models of care to reach the most remote populations. And we need to foster partnerships because this requires all of us to work together. This might seem like a huge, overwhelming task, and it is, but we can't let the scale of the problem paralyze us. Every action, no matter how small, makes a difference. Supporting organizations that train surgeons, donating to groups that equip hospitals, spreading awareness by sharing these stories. It all adds up. It all contributes to a growing movement, a global chorus demanding health equity for all. We are at a tipping point. So the next time you hear about Africa, I want you to think beyond the headlines of war and poverty. I want you to think of the heroes on the ground, the surgeons, nurses working miracles with limited resources. I want you to think of the patients, the Samuels and Fantas whose lives have been transformed. And I want you to think about the role you can play. Because building a world where everyone has access to the care they need is not someone else's problem. It's our problem. It's our shared responsibility. And it's our shared opportunity to build a more just and compassionate world, one surgery at a time.